reason I was interested in inviting you to the show was I had my 6-year-old daughter in, and she was having some trouble seeing things, and you were able to prescribe some corrective lenses for her. So how do you tell her, what are the advantages for, a 6-year-old compared to a 40-year-old? Or, how do genetics play into this?
Well, genetics play a role, but they don't tell us everything.
Okay.
So what we really need to do is take a look at kids. For me, one of the most important things I think people can do is get their kids in to be looked at, because kids don't know how they're seeing. The world's been always how it is. If it's been blurry, they don't know it's blurry. And there's other things we need to look for as well. And one of the really things that we're really big in my office is making sure people are looked at so they can know vision impacts learning, vision impacts how you perceive the world, and so you really need to get those kids in and get them looked at. At my office, we're part of what's called Infancy, so we will see kids starting at 6 months old.
Oh, wow.
That young.
Really?
And we do those for free, between 6 months and a year. We do them for free because we want to find problems early. One of the most frustrating things I find as an optometrist is when I get a kid in who's 11 and 12, and now they're having vision problems, and we look at it, and it's something we need to fix when they were 3, 4, or 5. And we can't do anything about it now. And that's very frustrating for me. And so we want to make sure kids are seen early. We want to make sure that they're, ready to learn, ready to attack the world. And so it's important to get those kids in early. We like to see them, like I said, between 6 months and a year, at 3 years old, then before kindergarten, just to make sure that they're ready to go.